purpose of this presentation is to help hospital trustees and others use the Hospital Compare website to get information about how their hospital and other hospitals of interest to them perform on important quality of care measures. We're using the Hospital Compare website, produced by the federal government through the Medicare program, because it is the most widely used and authoritative website available to guide consumers about the quality of hospital care. You can use a search engine to locate the Hospital Compare homepage shown here, or type in the website address www.medicare.gov/hospitalcompare. Let's get right to it and find a hospital of interest to you. Enter a zip code, city, or state, or the name of the hospital. For example, we're entering the zip code of Burlington, Massachusetts, 01803. And then click Search. The website will then display a list of the hospitals located within 25 miles of the zip code. You can expand the search area by clicking on this drop-down menu. You can select up to 3 hospitals to compare. Let's select our 3: Winchester Hospital, Hallmark Health System, and Emerson Hospital. The names of the selected hospitals will appear at the top of the page. Then click the Compare Now button. The website will then display the names and locations of the 3 hospitals that were selected, along with a choice of types of quality of care measures to select. For example, you can choose from measures from surveys of patients' experiences with care, measures of timely and effective care, and measures of readmissions, complications, and deaths. For our purposes, we're going to select readmissions, complications, and deaths by clicking on that tab. The website then displays the measure categories offered under this tab. We're going to focus on unplanned readmissions, so we will click on that measure set. Measures of 30-day unplanned readmissions show when patients who have had a recent hospital stay need to go back into a hospital again within 30 days of their initial discharge. Below, the rates of unplanned readmission for each hospital are compared to the U.S. national rate. The rates take into account how sick patients were before they were admitted to the hospital. We see that for each of the 3 hospitals, the measure analysis concluded that the hospital's readmission for heart attack patients was no different than the U.S. national rate. The U.S. rate for the measure was 18.3%. Let's look at more details. The website provides additional information, such as the time period covered by the measure data. It explains what it means to be no different than the U.S. national rate. It explains how many hospitals in Massachusetts and the United States were evaluated, and how many were scored as better than, worse than, or no different from the U.S. national rate. Let's look at the readmission measure data in graphic form by clicking the Show Graphs button. The bar graphs shown here display the readmission data in a different format and add some new information. The national rate of readmissions of 18.3% is represented by the vertical dashed line that appears in each bar. The readmission rates for each hospital are displayed just above the shaded area in each hospital's bar. Winchester Hospital had the same exact rate as the U.S. national rate, 18.3%. Hallmark Health System had a rate of 18.4%, and Emerson Hospital had a 17% readmission rate. The bar graph also displays how many patients were included in the hospital's readmission rate measure. For example, 159 for Winchester Hospital. Just above the bar graphs is a legend that explains the meaning of the shaded areas of the bar graphs and the color shadings that appear in the bar graphs. Let's go back to the hospital results page. And then to the measure selection page by clicking the Compare Now button. We're going to select the tab for readmissions, complications, and deaths again. This time we're going to select the healthcare-associated infections measure set. Healthcare-associated infections are infections that people get while they are receiving treatment for another condition in a healthcare setting. Many can be prevented through the use of proper procedures and precautions. We're going to focus on central line-associated bloodstream infections, often called by the abbreviation CLABSI. We see that for each of the three hospitals, the measure analysis concluded that the hospital's CLABSI rate was no different than the U.S. national benchmark. Let's look at more details. The website shows the actual number of CLABSI infections reported in column A, 0 for both Winchester and Hallmark, and 1 infection for Emerson. Column B shows the number of infections predicted for each hospital, which is based on the volume of patients treated at the hospital, certain patient characteristics, and the type of patient care units operated by the hospital. The Standardized Infection Ratio, or SIR, compares the actual number of infections at a hospital to the number of predicted infections. An SIR below 1 means that there were fewer than expected infections. If the SIR is above 1, there were more infections than predicted. 2 of the hospitals shown had 0 infections, so their SIRs equal 0. One hospital had 1 infection versus a prediction of 1.715, so its SIR equals 0.583. For infection measures, the national SIR is always equal to 1. And even though the evaluation box says that the 2 hospitals with 0 SIR scores were no different than the national benchmark, their SIR scores of 0 are the best possible scores. Let's view the same information in graph form. In the bar graph display, the U.S. national benchmark SIR equal to 1 is represented by the vertical dashed line. The SIR for each hospital is displayed just above the triangle marker. The bar graph display also adds new information, namely the SIR values for all Massachusetts hospitals combined. Massachusetts SIR is 0.427, indicating the statewide number of infections, expected infections, is less than half the predicted number. Just above the bar graphs is a legend that explains the meaning of the shaded areas of the bar graphs and the color shadings that appear in the bar graphs. Let's conclude back on the Hospital Compare homepage. The tabs at the top of the page will take you to other helpful parts of the website. The About the Data tab will help you find more information about the available quality measures. At the Resources tab, you will find a glossary that explains the terminology used. And the Help tab will bring you to a set of instructions about how to use the website, much like this tutorial. We hope this tutorial has been helpful. Good luck using Hospital Compare.